Hello, welcome to my channel. Now talk about the importance of knowing what are the signs and symptoms of anemia. That is anemia. Anemia, or decreased hemoglobin concentration in the blood, may be due to various causes, and the most common is the lack of iron, but can also be a symptom of an underlying disorder. Symptoms of childhood anemia. Anemia can be asymptomatic. It happens when you suffer as a result of infection. Is temporary, depending on the severity will manifest itself in one way or another. In less severe, the child will complain of fatigue and cold. You'll also notice pale lips, hands, the inside of the eyelids and the nail bed, the skin found under the fingernails. When it is more serious, completely loses his appetite, and has tachycardia, shortness of breath and irritability. If anemia comes from a lack of iron, the child is more asleep, eat less and fatigued, listless and lack of concentration, which could affect their school performance. It could also be a symptom of anemia when the child does not develop according to their age. Symptoms of anemia. Anemic syndrome is formed by a set of signs and symptoms that show the decrease in hemoglobin and development of the compensation mechanism. The main symptoms of anemia are pallor. It is one of the most characteristic signs of anemia and a direct consequence of the widespread vasoconstriction, closing of blood vessels, and the decrease in the concentration of hemoglobin in blood. Asthenia. The most common symptom is fatigue, occurs because there is insufficient hemoglobin in the blood. Hemoglobin is an iron-rich protein found in red blood cells that carries oxygen throughout the body. Dyspnea. Hemoglobin is a molecule found inside red blood cells and serves to carry oxygen to the tissues. So when there is severe anemia, tissues and organs of the body do not get enough oxygen, the person feels tired, your pulse is racing, poorly tolerated effort and has sensation of breathlessness. Muscular fatigue. People who suffer from iron deficiency experience pain feeling knots in muscles, according to the American Society of Hematology. The pain is due to lack of oxygen in the muscles. In addition, the red blood cells removed carbon dioxide and waste products from the muscles. When red blood cells are low, toxins build up, which can also contribute to muscle soreness. Cardiocirculatory demonstrations. If there are not enough red blood cells to carry hemoglobin, the heart has to work harder to circulate oxygen, reduced blood quantity. This can cause arrhythmia, murmurs, enlarged heart, and even heart failure. Tachycardia and palpitations that are constant in case of moderate or severe anemia, especially when it sets up sharply. In a slow-onset chronic anemia, the only noticeable sign of anemia is a functional systolic murmur, noise that makes the blood out of the heart. If anemia is very intense, tachycardia, rapid breathing, or unconsciousness is superimposed. Neurological disorders. Impaired vision. Headache. When hemoglobin drops below 30 grams, severe anemia, signs of cerebral hypoxia, headache, dizziness, and even coma may occur. There may be changes in gait, balance, and in more severe cases alterations in behavior. Vitamin B12 is essential to the proper functioning of various cells, including nerve and blood. The low availability of this vitamin in the body gradually leads to the appearance of neurological problems. Neuropathies. Vitamin B12 deficiency can occur even before anemia is diagnosed. Changes in menstrual rhythm. The existence of heavy periods, menorrhagia, is the most common cause of anemia in young women, but is usually moderate anemia, HB, 90 to 110 grams, L. However, when the anemia is more intense, often it is seen a decrease in menstrual rhythm, prone to amenorrhea. What happens is that, compared with the decrease of hemoglobin, the body reacts by decreasing or even negating blood loss. Risk factors. If you experience heavy menstrual bleeding, your risk of developing anemia is high. Many women are not sure how to define your heavy periods. Symptoms include bleeding that fills a tampon or pad every hour during the bleeding that lasts longer than 7 days and several hours, periods accompanied by severe cramps or blood clots. Discuss these symptoms with your doctor. Sometimes it is a symptom of uterine fibroids, non-cancerous growths in the uterus that cause bleeding and pelvic pain. Kidney impairment. Anemia is common in people with kidney disease. Healthy kidneys produce the hormone erythropoietin, EPO, which stimulates the production of red blood cells in the bone marrow, a spongy material inside your bones. Diseased kidneys often do not produce enough EPO. As a result, bone marrow fewer red blood cells. Almost all people with advanced kidney failure, when only 10% of your kidney works, have anemia. Apart from the low level of EPO, anemia is also caused by blood loss due to dialysis, a treatment for kidney failure, bleeding and other conditions. A water retention that can lead to the appearance of edema or swelling in the legs occurs. So far this information. Do not forget to give you a like, subscribe to my channel, share.